On this episode, we'll be welcoming Dr. Amanda Marrone. She is a family medicine doctor as well as a lifestyle medicine practitioner at Optimal U. We'll be talking about lifestyle medicine and what it is, what types of tests you should be getting that you're probably not, and why the future of medicine is becoming more individualized. Amanda, welcome to the Totem Wellness Podcast. Awesome to have you here.
Hi, thanks for having me.
Obviously, you are a lifestyle medicine practitioner, and we'd love to start with what is lifestyle medicine? How is it different than what we in our Canadian population are accustomed to?
So, lifestyle medicine is a branch of conventional medicine, although it's a small branch gaining momentum now in Canada. It's much bigger in the US right now. And it uses behavioral intervention, so counseling-based approach and behavioral interventions of the patient to prevent and treat chronic disease. So we use lifestyle as medicine. And this is quite different from, our healthcare system as it stands, which is largely reactive, right? We're trained as conventional doctors, and I was trained as a conventional physician as well, to detect and treat disease after it appears. Typically, we treat with pills and procedures. There's sometimes some counseling involved as well. There's just time constraints and training constraints around that we don't do it as much. But we're reactive in our approach. And for acute disease, that's fantastic, right? Like if you have a heart attack, wow, I'm so glad we have pills and procedures and a conventional approach to treat that, right? Because we can get you back on track. If you break a bone, we have surgical procedures to bring that bone back together. If you have an infection, you have, antibiotics to treat you. So we know that it works really well for acute disease. Conventional medicine works really well for acute issues. But when we translate that to treating chronic disease, it's just not working. Like pills and procedures just are not working, because if it were, we would see decreased incidence of disease, chronic disease that is, and we're not. We're seeing higher rates of chronic disease. And what's more frightening is we're seeing it now in younger and younger patients, right? We're seeing, diabetes, type 2 diabetes surface in children. We're seeing heart attacks surface in 30 and 40-year-olds, cancers as well in 30 and 40-year-olds. And so lifestyle medicine kind of flips that model. We are not reactive. We instead of asking what drug treats this disease, we ask kind of what conditions are present to cause this disease to happen. So we're looking at root causes. And when we look at the evidence, we know now from decades of literature that 80% of our chronic diseases that we're treating is rooted in lifestyle factors. And so we focus on these 6 pillars. And they're not rocket science. They're pretty straightforward. We've got, nutrition, physical activity, sleep, stress management, avoidance of harmful substances, and social connection. And another big difference is that in lifestyle medicine, the patient is part of the solution. Instead of us passively prescribing treatments, the patient is the treatment, because if 80% of chronic disease is rooted in lifestyle, that's kind of where we have to start. So those are the kind of main differences.
That is super exciting. And obviously, you have known us for quite a while now, and you know that all these areas that you talk about with the pillars are really exciting things that we have worked in for decades. And we really believe that so many improvements can be made on a day-to-day basis. And even just, we're talking about disease prevention, obviously, but the other side of lifestyle medicine that I think is really exciting, and what we see, and we're so fortunate in the work that we do, that we could start with someone and maybe 2 weeks later, they're going to come and report to you, I'm sleeping better because I'm exercising, I'm eating better. My blood pressure has come down a little bit because I'm doing these things in my everyday life. And I think that is something that is really exciting, that it is now moving into the medical field, because prior to lifestyle medicine, there was a real divide between kind of what we do in our everyday work. And then when someone would go see their GP, they would get these tests done, and then they'd either say to us, okay, I'm on track or I'm off track. But there was never a supportive conversation happening saying, I really want you to exercise and I really want you to make these lifestyle changes. And my gut feeling is because the volume that happens in those offices and the limited time, we both know that these conversations are difficult to have. And I believe that when you're meeting with patients now, you get to have a bit more time with them than is what people would expect traditional time with a doctor would be. Are you noticing that with that extra time, you can actually drive good results from the work that you're doing?
Oh, absolutely. I mean, time is health. I mean, if you look at the definition of health, right, it was defined back in 1946 by the World Health Organization as complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So true health care actually involves addressing those three things. But first of all, we don't have time, and that's an understatement for a lot of family doctors in particular. And I am a family doctor by trade, and I have, had practiced in that model. And I always ran over time because once I learned what I learned about changing, lifestyle habits and how effective they were at reducing the chronic disease burden in my patients, I couldn't not do it. But these conversations don't happen in 15-minute or 10-minute blocks. You can spark conversations and thoughts, and it's not impossible to at least have some discussion. But having, we have a whole hour with our patients, even just for the assessment, and then an hour in follow-up, and we can do a lot more
incredible
deep dive, right? The other thing is we're just not trained. I mean, in my training now, I'm going back, 20 plus years ago in my training. And there was zero training on not only just nutrition and physical activity guidelines, like none of that was in my training, not even my residency program. But there's absolutely no training on how to have these conversations, how to move the needle for patients, because you can't, just like you can't force patients to swallow pills, you also can't force them to make lifestyle changes. You can't tell them what to do. In lifestyle medicine, though, like in my training, we've been trained to, inquire without judgment, gather information, not just about, blood work and assessment, markers, but also about their lifestyle habits. And then, meet them where they're at, find out what matters to them, find out where they feel their gaps are. Because I can talk about nutrition all I want, but if the patient is feeling super stressed, you have to start there. And stress is a major pillar for chronic disease, and we need to address that. And we're just not equipped to do that in the conventional model, and nor are we, nor are we given enough time to do that.
It is so exciting that now we're seeing this shift. And what's so great from our standpoint and from where we practice is we did have time in a way. And so if someone comes in, say I'm treating someone for low back pain, I'm spending a good 30 minutes with them. And it's interesting how you say that, if you have chronic stress, or in our case, sometimes it's the people who aren't sleeping.
Mm-hmm.
And we have that training in a way that I understand that if I can't get my patient to have a good night's sleep and to manage the chronic stress, I'm not going to do a good job with their low back pain, because I've got to solve kind of this bigger problem first. The other piece that I really love is that the testing that you're doing now with this, so with the blood work and with the MVO2 and with the DEXA, it really motivates and reinforces the conversations that we're having. So I'm wondering if you can talk a little bit more about what you think the importance of, the blood work and that testing is, and then how you're using that data.
Sure. I look at blood work as kind of like a window into what's happening inside the body, ideally long before symptoms or clinical issues appear, right? And so as lifestyle clinicians, we're not just looking for disease, right? We're looking for patterns that tell us how somebody's metabolism, how their inflammation, how their cardiovascular risk is evolving over time. And that's key, right? More valuable than a single number is a trend over time. And so if someone's fasting insulin or triglycerides, for example, are slowly creeping up over the years, that signals early metabolic dysfunction long before diabetes actually appears by our, fasting sugar and hemoglobin A1C, guidelines tell us that it is established as diabetes. So giving us that signaling ahead of time allows us that ability to see if the patient is ready and able to make changes. I always tell my patients, I'm the GPS, you're the driver, right? Patients, another big difference with lifestyle medicine is the patient's in charge. Like, we do put the patient in charge of their health, and we let them drive which lifestyle factor. And, I do want to stress, though, that, and I remind patients of this, that blood work is only one piece of the puzzle, right? It always has to be interpreted in the context of lifestyle habits, for sure, body composition, fitness, sleep, and stress, right? And this is something that we also take a lot of time in our assessment. It's not just about the blood work or the DEXA; those are really important tests. But we're out to find out what's happening on their day-to-day, because that gives us a lot of information if we're going to get to root cause, change. And so the goal is never to chase lab numbers. It's just to use them as feedback, and then about how well the body's functioning and how those lifestyle changes are moving the needle. And you're right, like, that's where it's very valuable, is if you order blood work and then the patient is engaged in making some changes, doing blood work, again, say 6 months later, reinforces, because when they see the effect, then it also drives that habit and behavior change.
I find it interesting because you have, obviously, your training's in the traditional Canadian medical system, mm-hmm. and you've made this shift into the organization that you're working with is called Optimal You. We'll talk a little bit more about that. But that's where you've got an Optimal You individual is coming in. You're spending 2 hours with them as part of their program. And in your traditional practice, I'm sure that you're spending more time than you used to, because you understand how effective it is, but you're not spending 2 hours. So
never. Yeah. Conventional.
Yeah. With Optimal You, what types of things do you feel are great additional tests that people that are solely in the public system might be able to look at to get, like, this is a really important insight for you mm-hmm. to have. So I recommend getting this particular test done, or these tests done.
Gee, how much time do you have?
Let's go top two, or two important ones.
So I definitely think, like, the cardiometabolic testing is really important. A fasting insulin, it's not used conventionally. It's more the functional medicine world uses it, but I find it's very helpful because, 10 years before you develop diabetes, you've got years of insulin resisting mounting. And even if your blood sugar is normal, if your fasting insulin is high, it means that your pancreas is working overtime to keep that sugar normal, that blood glucose normal. So a fasting insulin is helpful. And along those lines, like ApoB and lipoprotein(a), we tend to, for cholesterol. So we tend to use LDL cholesterol as, what's used a lot in conventional medicine. And not that it's not useful, but that just tells you how much cholesterol is in the system. And cholesterol is a needed part in our body. Like, it's a needed molecule in our body. It helps build, hormones, and it helps build our cell walls and maintain them. But ApoB is the protein that binds that cholesterol, and that's actually what's the most atherogenic. That's what will create plaque in our system. And so knowing your ApoB is very valuable, because it tells you how much of that cholesterol is actually harmful. Because you could have a high cholesterol and low ApoB, and that low cholesterol or that high cholesterol is maybe not as harmful for you, or vice versa. You could have and more dangerously is you could have a normal LDL-C, low density cholesterol, and you think everything's fine. But if you measure the ApoB and it's high, it means that there are more cholesterol, the lipoproteins that are causing the actual damage to the artery walls. And lipoprotein little a is like a genetic. It's a genetic marker for your cholesterol metabolism. So it's only meant to be, that one's only meant to be done once in a lifetime, because it just tells you, like, are you more predetermined to have higher cholesterol and cardiovascular damage from that cholesterol? And medications, while medications and lifestyle work on ApoB and LDL-C, they don't work on lipoprotein little a, but knowing that your lipoprotein little a is elevated is important, because then you have to really hone in on those other risk factors, and make sure that you're targeting them and keeping them as low as possible, so that your genetic predisposition doesn't, come back to bite you in the butt. And if I could mention one other test that I find is important, and maybe this is not something that's special to lifestyle medicine, but is ferritin for women. I mean, there's a lot of information about perimenopause and menopausal women, and I am one of those women, and I love all that information, and it's very critical. But we are kind of doing a disservice also when we're not talking about low iron states in our young female population. They're in their 20s and 30s, especially these women in their 30s, and say they're in their childbearing years, they're having kids, they're having periods, they've lost blood along the way, they're not supplementing. And even if their hemoglobin is normal, that's your red blood cell count, and iron's responsible for that. If your ferritin is low, if it's less than 50, you are depleting your mitochondria of a very valuable, booster. Like, you need iron for your mitochondria to function. So we have a lot of women walking around feeling exhausted. They go see their family doctor or their healthcare provider. They get a hemoglobin done and it's normal. And even if they get a ferritin done, it's not managed, because even if it's low, as long as their hemoglobin's normal, they're told, well, everything's fine. It's just your stage of life. But I actually treat low ferritin very seriously. Like, it needs to be supplemented. It needs to be above 50 in women and men. Obviously, men don't have the problem necessarily as much because they don't lose blood. But that's a huge population that I feel like we're missing. So ferritin's also on my list, and sleep studies. Sorry, I'm squeezing one more in there.
I love it. I love
Sleep
it.
studies, because I also do a lot of work in the OR, and the number of times we see patients stop breathing, when they're sedated, it's alarming that there's a lot of undiagnosed sleep apnea going around, amongst our population. And undiagnosed sleep apnea and untreated sleep apnea is a major health risk, not only because it interrupts our sleep, which is when our body restores and repairs itself, but it is linked to hypertension over time. And over more time, it's linked to more sinister things like atrial fibrillation. So that's an irregular heartbeat, which can lead to stroke. And it's also linked to cognitive decline and dementia. So at Optimal U, if we do a screening questionnaire for sleep apnea, and if you hit any of those, red flags, you're sent home with the home sleep study. So no longer do you have to actually go to a clinic and not sleep in the sleep clinic because you're attached to all these wires. You have a simple kit that has a little monitor attached to the base of your neck and an O2 sat monitor on your finger, and you can sleep in your own environment. And it is medical grade. It is as effective at detecting sleep apnea.
Okay, so I just want to review those four because they're all sound to me. Obviously, we all know what it feels like to have a bad sleep.
Yes.
When it's a chronic bad sleep, I think those people don't actually know the difference anymore because they've just gotten used to feeling the way that they feel.
Yeah.
But the other three sounds like these are things that you should measure because you feel normal, but they are indicators of future problems that are likely to occur if this doesn't get addressed. Is that fair to say?
Oh, yeah. Yeah. I mean, you can't feel like, oh, my ApoB is high today. Like nobody walks around feeling that. Ferritin, yes. Like women do, and men, I shouldn't just say women, but people with low ferritin will feel chronically tired because their mitochondria, which depends on enough iron to run and your mitochondria, by the way, I should backtrack, is your battery of all your cells. So it's like running, running around with like your batteries half charged, and people feel exhaustion. So that one, yes, but things like your fasting insulin and your, ApoB and lipoprotein little a, you can walk around and not know. And you could have the most kind of critical thing is that you could have the conventional testing. You could have an LDL cholesterol or cholesterol panel, and your LDL is normal. And so you think you're below your target, for example, for your age category, your risk category, and you think you're fine, but you haven't measured the ApoB, which is actually the critical piece of what causes plaque in the arteries. And so, yeah, and you could be falsely reassured by even these conventional tests, in my opinion. And same with blood sugar. If your blood sugar is normal and your hemoglobin A1C is normal, that's great. But if you have a high fasting insulin, especially in the context of, say, obesity or central fat, so your waist circumference is above target, and or you've had a DEXA scan showing increased visceral fat. So even in advance of getting, your blood glucose down the line showing that you have diabetes, your insulin can be elevated, your fasting insulin can be elevated, and you don't even know it, you don't feel it.
This is such interesting advice, and I think so incredibly valuable. To your point about the ferritin, I coach track and field with, females who are in that age range kind of that we're talking about and a little bit younger. And I can tell you that when we ask them to go have their blood work done, and keeping in mind, we're asking them because we suspect that something is happening, 100% of the time, they are testing low ferritin and low vitamin D. And even though at the beginning of the season, we're telling them all, we're showing them pictures, we're saying, please take your vitamin D. It's really important. It's important for your training. It's important for your recovery, all these things. And once they get this test done, they do change behaviors, and it's wonderful. And you see that they feel a lot better and they have more energy, and it's simple. It's not something that's really complicated. And in some ways, for me, it's heartbreaking that there are probably millions of people out there that are low in these things and don't know about it. And it could be such a simple change to feel better. Speaking of the testing and making changes, I did the Optimal You assessment when we were working on the pilot, and it was fantastic. And Tim and I are continually amazed that I made some really big changes after the assessment. And I think that is interesting because I work in this industry, and it's not that I don't have the knowledge. It's just that I never took the time to test myself and say, where am I at? And then I also, we were both wearing the Ultra Human rings. So now we have a much better awareness of our sleep and our activity. And again, in my case, it's remarkable how that was a few months ago, and I made a few key changes from a nutrition standpoint. I added some higher intensity exercise. So I was moving enough, I was exercising enough, but it was all low intensity. I wasn't taking the time, to kind of like change into my gym clothes and do a really high intensity workout because it just wasn't fitting in my schedule. But once I saw the results, I said, I really need to stop taking for granted that, I look okay and you can't really tell and I feel okay, but I actually inside things were not okay, and I needed to make those changes. I'm wondering if you're noticing more of this from the people that you had testing through Optimal You.
Oh, yes. I mean, knowledge is power in medicine. I mean, in most of life it is too. And ignorance is not bliss. So just knowing, I remember with one of my patients I followed up with, he used the tool. He saw the blood work results even before we had our 1 hour kind of follow up. So, we can talk about later about how we do things with Optimal U if you'd like, but we get a 1 hour follow up to go over, and we create this kind of comprehensive, roadmap for the client or the patient to work towards, and involving lifestyle measures to make those identified issues improve, or to help make them improve. And he had already started, because he had done his VO2 max. So Tim kind of limited me to all, my top 3. I kind of stretched that to top 4, but VO2 max testing is super informative too, because it is, it's an evidence-based longevity, assessment, basically. We know from multiple studies now that VO2 max is not just a fitness metric, it's a powerful longevity marker, and it reflects how your body, delivers and uses oxygen. And with those changes, so when he saw that his VO2 max wasn't quite where he thought it would be, he started running again. So he had a right on the spot moment. Even before he had his follow up with all of his blood work measures, he already started to reintroduce, he running, and he's had some issues with his knees. So then he's like, I just discovered that I can push my heart rate if I just do walking on an incline. So I just set my, my Peloton on an incline, and I can get my heart rate up. So he started to find ways, and it motivated him. So, oh yes, I do believe that knowledge is fuel for habit change for people, because they can't ignore it. Because once you see it, you can't unsee it. And so it does drive that interchange. And then what happens is this magical thing. People start to feel better, right? It's not just about like, oh, my numbers, I have to do it well because I'm scared, because I saw my ApoB is high, or my fasting insulin is high, or my DEXA showed increased visceral fat, and now I'm worried. They do it initially because of that wake-up call. But then over time, they're like, oh my goodness, I actually feel so much better. I'm eating differently. I'm shifting my activity. I'm sleeping better. And then they start to do it, not because they're scared. They do it because it feels good. And so I always tell patients in lifestyle, like, the side effect is you'll feel better. If you're okay with that, then go for it, right?
Just so exciting.
Yeah.
And I think in some traditional settings, and how healthcare used to work, when you have the 15 minutes with the patient, you don't have time to try to make lifestyle changes. And so then what we would see, I'll give you an example. You have high blood pressure, high cholesterol. Here is 1 pill for the high blood pressure and 1 pill for the high cholesterol. And then they would come back to us and, be getting treated or whatever for whatever injury they have. But then on top of that, they're telling us that they feel so much worse because of the side effects of the medications that they're on. And it's kind of this, in a way, almost like a vicious circle, because some of the, the ones that we see that are very common for high blood pressure are diuretics. And then they're feeling tired and they're saying, I wanted to go out for a walk today, but I'm really like, I have to go to the bathroom all the time, and I'm just not feeling good. I'm not feeling energetic. And so then you'd see their activity go in the opposite direction of what it needed to. And instead, with this type of an assessment, we're seeing the exact opposite effect, which I think is really exciting and really fantastic.
Yeah, Stacey, you made a really good point there too. It's something I do want to highlight. Like, I do want to highlight, lifestyle medicine is a branch, not a replacement for conventional medicine. So, I would never, if I had a patient, in fact, I have had patients who have, a high lipoprotein, little a, an elevated ApoB, and maybe other factors, or their blood pressure is a little high. I would never say, like, let's not treat this with medication, but I would, at the same time, I would never now, knowing what I know now, I would never prescribe a medication without also saying, listen, this is a Band-Aid. This is going to fix the number, but we need to do the root cause. And the root cause is, your diet. Let's talk about your diet. Let's talk about your movement. Let's talk about your stress. Let's talk about your sleep. They work in synchrony. And then, so I would prescribe, if someone who's at high risk, say for cardiovascular disease, I would prescribe a medication. I would warn them of the side effects, but I would say, listen, this is not a forever thing. It doesn't have to be a forever thing. If you do, if you make some changes, and let's talk about how to go about making those changes, because that's a key part. Then we'll revisit it. And then once you've established those healthier patterns, then we can start to reduce your medications. Because even if that means you're on a blood pressure pill, but instead of one, you're on, instead of 3 pills, you're on 1, or instead of, max dose, you're on a small dose, and you're doing the lifestyle, they can still work together. It doesn't have to be all or nothing, one or the other. So, and oftentimes your side effects are reduced if you're living a healthy lifestyle. So you can be on some medications. People who have cancer, for example, and they're practicing lifestyle measures, they actually do way better on their treatment. So I just wanted to clarify, like, it's never a replacement for, it's to use alongside when necessary. And hopefully you need less and less of the pills and procedures approach, the more the patient is able to engage.
So as people gain this information about what's happening inside them, so it really is very individualized.
Mm-hmm.
From your experience as a lifestyle medicine doctor, how many of these, like if I had 5 things that were like, okay, well, these you could work on all 5 of these things. Mm-hmm. Presumably you're not going to say, go off and work on all 5 of these things. Mm-hmm. How many things do you think that is reasonable for somebody to pay attention to successfully? And about how long does it take them to make that part of their regular system or habit?
Yeah, I think it always depends on the patient. I kind of gauge that when I'm working with the patient to see, where they're at in terms of their ability to make change. Again, it's always meeting with the patient where they're at. And my approach with a patient who seems to feel like they're looking overwhelmed to me is I say, what one thing? Right. What one thing? That's my motto. Like, what one thing? I had a patient, this is back when I was in family medicine. I had a patient come to me, high blood pressure. She was overweight. And she said to me, she was a colleague, actually, she was a nurse colleague. And she said, listen, like, I know what I need to do. I know what the guidelines are. I used to be an athlete and I know I should be exercising 30 minutes a day, but I get home from my shift and I'm exhausted and I just can't do it. So she was telling me exercise was her thing. That's what she wanted to work on. So again, there's 6 pillars, but I can want to work on nutrition. But if the patient's saying they want to work on exercise, so that's P1. And I said to her, okay, you don't have 30 minutes. Do you have 5? And she looked at me kind of quizzically, and I said, could you commit? So you make one thing and make it small. I said, could you commit to every day, rain or shine, no matter what? Could you lace up your shoes and in one direction, as fast as you can, walk as fast as you can in one direction. And when that timer goes off at 5 minutes, you can either keep going or you can turn around and walk as quickly as you can back. Is that something you could do? And she kind of said, yeah, actually I could do that. Like that's doable. Like, but I felt like she didn't think it was actually going to do anything. I said, just start there and use that one thing and see where it goes. And, about 3 or 4 months later, I heard from her again. She was actually a colleague of mine. So she kind of sent me a text and she said, listen, I just need you to know, it was during COVID. So we were and I had just left my family practice, and she texted me. She goes, I need you to know something. That you told me 10 minutes a day. And now I've lost 10 pounds. My blood pressure has normalized, and I'm actually just taken on CrossFit. I'm hiking, 10 kilometers a couple times a week. I am feeling the best I've ever felt. And it all just started with you telling me to go out for 10 minutes. And I just needed you to know, like, that was my TSN turning point. Like, that was my game-changing moment. And so never underestimate the power of one thing. So if a patient wants all in and they're a go-getter and they want to start, I can work with that too. But most patients do well with one thing and one thing well. And building on that.
Such a great story and a great example. I know that on James Clear, the author of Atomic Habits, I'm sure he's a big listener of our podcast. He'll be very proud of you saying that, because I've heard him say that. It's like one thing. And if it's got to be 1 minute, It's 1 minute. It's fine. Just start. Right. And
It's so funny. So this happened this is now during COVID. So how many years ago was that? I kind of put that past me, but I just read Atomic Habits. And when I read it, I'm like, oh my gosh, he
This
stole
is what
my
I
idea.
did.
you were so close to writing that book.
There you
I
go.
was this close.
That's great. I love that story.
It's
Yeah.
such a good story. And it's so nice to see those outcomes.
Well, and one thing that we see on our side, so obviously we've been at this from an exercise standpoint and the rehab side of things as well for injury management. We've got clients that are been with us 20 to 30 years. So if they started in their 40s, they're now in their 60s, 50s, 70s, et cetera. We have 80-year-olds that are doing exactly the same thing that they did when they started. And clearly all the stuff that you've mentioned, exercise positively contributes to all of them. So if you can get some sort of exercise in your life, and obviously that's our business, so these people are coming to us for that purpose, it's incredible. It is such a superpower when it comes to health. And I don't mean having to go to the gym to lift weights or be on the rowing machine or do a class or whatever else. I look at it as, obviously there's lots of good stuff with that too, but general activity. What's your general activity? Are you 3,000 steps a day? Because if you are, you're looking for trouble when it comes to health measures. If you're 10,000 steps a day, that's a great sort of general activity level that people should aspire to. And again, it's not like, let's start walking 10,000 steps a day. It's working up to that. 10 minutes, whatever it might be. So, yeah.
Yeah, more movement. So that's why I don't tend to frame it with patients around exercise, because that kind of wigs some people out, especially if they're not used to exercise. I talk about movement. How can you add more movement? There's some new evidence, arising around movement snacks, taking a movement snack, even these short, intense little bouts, walking up the stairs briskly a couple times on your lunch break makes a shift. It makes a shift not only in your cardiometabolic factors, but in your longevity and your ability to move. Because the whole point of this is to not just live long, but live well. Health span, the number of years without disease or infirmity is really important, because it's one thing to live a long life, but you want to live it healthfully. And movement is definitely, not the only pillar. I mean, all of them matter. I can't emphasize that enough as well. There's 6 pillars and they're all of equal importance. And if one is off, you can get disease. But movement is one of those ones that it really packs a big punch. Mind you, so does sleep, so does stress. I love them all.
They're all good.
It's hard to pick one.
It's hard to pick just one.
This is what I love about this conversation. We've been doing this, as Tim said, for over 30 years. And one of the real big frustrations for us, I would say approximately 20 years ago, was the trendiness in health and fitness and diets. And we have seen them all come and go. And because lots of times they have big marketing campaigns behind them, the grapefruit diet and then the watermelon diet and all kinds of exercises, this exercise reduces belly fat and literally we've seen them all come and go. Mm-hmm. What I'm super excited about right now and what I love with what you're doing with Optimal You is we've always talked about science, and science is in our name. And I'm finally seeing that the messages and that the information is real, it's science-based, it's supporting the things that we've talked about all along, but they weren't sexy and they didn't have marketing campaigns behind them and they weren't really out there, because to attract attention in some ways, you got to be really out there and then people start listening. MVO2, when we started, was only something that elite endurance athletes would do. And those were the only people that talked about it and even knew what it was. Now it's a part of regular conversation, as is weightlifting. Weightlifting's not for athletes anymore. It's for everyone. We all know it's effective. We all know it's efficient. Oh, yeah. And I couldn't be more excited, even with things like the podcasts and what we're talking about and the great information that's out there. I think with AI, it's going to get probably the information will get even better because we will all quickly know what's the new research, what does it say, what do these markers mean, and the reports that you get from Optimal You are very extensive. And you talked about your one patient who, before you even met with him, he'd probably gone through the reports that were sent to him digitally. And he probably looked at many things. And then you have the ability in 1 minute to go research this and say, what does this number mean? And what should my optimal be? And I think that we're really starting to be on an exciting frontier with healthcare and helping people feel better and live life with a much longer health span. So I think it's wonderful.
I agree. I couldn't agree more. And yeah, I mean, there's a lot of fads out there. I mean, the fads used to be in diet, right? The fad diet, which diet works best, and the quick fixes often targeted around weight loss. So if weight loss is your goal, like that's where we try to shift that patients away from focusing on diet for weight loss. Weight loss should be a healthy side effect of a good diet, not the goal of the diet. The goal should ideally be what's going to give me longevity, health, and function. And I always tell patients too, like, oh, I can make you lose weight. Like, I can starve you. I can put you on chemotherapy. I can get you hooked on heroin. All of those promote weight loss. None of them promote health. So we need to focus on health first. And magically almost, when you follow a diet that's very high in fiber and high enough in protein from, lean animal and even a lot of plant sources of protein, don't forget those, and rich in antioxidants and a variety of foods and whole foods, unprocessed foods, then you will lose weight. Like it's going to happen. Your body, your metabolism will shift in a way that causes weight loss. And now the fads have shifted into other things. Like, people are looking for magic bullets to live a long life. And really there's no magic bullet. You can't take a magic bullet if you're not doing the work as well. Like, it's really important that we remember that, if we look at the longest lived populations in the world, the blue zones, for example, they don't take any pills or peptides or boosters or this or that. They don't even focus. They naturally just live in an environment that promotes healthy lifestyle. And when they do that, they live long, functional, wonderful, vital, lives.
That is a awesome summary right there, and I think a great place to stop for today. We could continue for
so much to
couple
talk
more
about.
hours, but this has just been so great. Amanda, thank you so much for sharing all your thoughts and insights and educating our viewers and listeners about what lifestyle medicine is and what Optimal You is doing, which is like, we're just so thrilled about it.
Yeah, thanks for having me. Look, I also have this that I got when I spoke. Look at
Hey, nice hat.
See that?
Cool
Yes, totem hat.
It looks so good on you.
Oh my gosh, I wear it all the time. I love it.
That.
And my jacket.
We can't
Oh,
wait
that's fun.
to do more with you.
Yes. Thank you so much. Thanks for having me. And hats off.
Wonderful.
Take care. Good to see you.
Thanks, Amanda.
Nice to see you too. Take care.
Bye-bye.
Bye-bye.
Thanks for listening to the Totem Wellness Podcast. Please follow us on Apple, Google, or Spotify and leave a 5-star review and comment. Subscribe to us on our YouTube channel and please spread the word to family and friends.